Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to your Direct Connection. We begin tonight with your questions about whether and how public schools can safely reopen. It's a hot topic in Montgomery County, as Nancy Yamada tells us.
The message to the county executive is that we feel it was an egregious overreach.
Parents who send their children to private and/or religious schools in Montgomery County rallied in front of the county executive's office building, their signs and voices a united front.
I have 5 children in private schools.
We fear that the county will continue to just make it impossible for our schools to open, continue to move the goalposts. They haven't set clear metrics as to what they're looking for. They haven't looked at the school's plans.
Our private schools are smaller than the public schools, and they are able to open safely, and they are not under the authority of Dr. Gales.
The governor made that point clear when he issued an executive order banning Montgomery County from prohibiting in-person learning at private schools, as the county executive sought to do. Multiple lawsuits were filed, and just when it looked like the county wouldn't be backing down, the county health officer rescinded his health order. What do you think about Governor Hogan and what he did?
He's my hero.
And many parents point out that their private schools have spent a great deal of time and money this summer making sure that their schools and individual classrooms are safe for in-person learning.
They will have staggered drop-off times.
Upgrades to HVAC systems to better improve air circulation and filtration.
Temperature checks, using the exterior classroom doors, frequent hand washing.
Now for a look at what non-public schools, independent schools in Maryland and D.C. are planning to do. We're joined by Peter Bailey. He is the executive director of the Association of Independent Maryland and D.C. Schools. Thank you for being with us. What do you know about what the majority of your member schools are planning to do at this point?
So let me begin with a little bit of context, and thank you so much for inviting me to join you this evening. So Ames has 120 member schools, roughly 20 of them in Washington, D.C., and the remaining 100 in the state of Maryland. And the schools in Maryland span nearly the entire state and include schools that are urban, rural, and suburban. Our smallest school includes about 20 students, and our largest schools have nearly 1,500 students. And our schools include institutions that educate the full range of ages from preschool through senior year in high school. It's important to understand that these schools are diverse and have a variety of different missions. All of them are not-for-profit. All of them are governed by a volunteer board of trustees, and all of them have a non-discriminatory policy. So those are the characteristics that hold our schools together. That said, as you can imagine, and as we heard from some of the parents in Montgomery County, our schools have been working hard over a period of months to prepare plans and to prepare contingencies for what is an ever-changing situation. One of the things that we remind ourselves frequently in our schools is that we are living in an environment of VUCA, V-U-C-A. And that acronym stands for volatility, uncertainty, complexity, and ambiguity. And
well, there's no doubt about that. But I guess for when you're running a smaller school, an independent school, does the independence give you more flexibility? Or on the flip side of that, do you maybe not have the resources that the big public school systems have when it's time to set up something as complicated as distance learning.
Yes, so that's true. And the reason that I describe that environment of VUCA is to give you and your viewers a sense of what you all already know, namely that this is a very, very complicated environment. And our schools have typically prepared for 3 different general scenarios. 100% on-campus learning as one scenario, a hybrid or modified model as a second scenario with a combination of on-campus learning and distance learning. And then the third scenario would be 100% distance learning. And as the environment changes almost daily, our schools are paying very close attention to which one of those learning modes makes most sense for the opening of school in September. And as you've said, and as the parents in your video piece articulated, there are ways that independent schools, because of their smaller size and because of their tighter turning radius, if you will, can make changes and alterations and adjustments fairly rapidly and fairly effectively. But that said, our primary goal is to make sure that we are providing a safe learning environment for students and a safe work environment for our employees.
Let me remind our viewers, if you have a question, you can give us a call. We'll have the number up on the screen. You can also email your questions to livequestions@mpt.org. Peter, if you had to guess, if you took a census in the middle of September, how many kids at the schools you represent are going to be sitting in a classroom at least one day a week? What would your guess be?
So my guess is that some, or perhaps many, of our students will be sitting in a classroom for some portion of each week. I know that right now, as of this date in August, we have schools that are planning to open 100% on campus because of their particular geographical locations and the facilities and campuses that they have available. I know that many of our schools are planning for a hybrid mode in opening in September. And then several of our schools have already said that they intend to open with 100% virtual learning. So I think we're seeing a variety of articulated plans right now. And I think in mid-September, that situation will continue to be in force. In other words, some kids will be in school, some kids will be in school part of the time, and some kids will be learning virtually 100% of the time in the early part of the fall.
I saw the word cohorting used to describe what some schools are planning, like there would be a cohort of kids, which sounds like something I would have been sent to the principal's office for back in the day. But help me get this right. The idea is that you're going to have a group of kids. It may even be the same group of kids and the same teacher that you had last year, but just to continue that familiarity, you're going to continue that into a new school year.
That's exactly right. And another word that is sometimes used in the way that cohort is the word pod. And the notion there is that a small group of kids, 10, 12, maybe up to 15, would stay together, move together, study together with one or two teachers who are specifically assigned to that group. And the notion there is that kids would not be mixing and mingling with other larger groups of kids regularly as they would normally be doing in a typical school year. So in that mode of instruction, you would have less movement to specials classes, perhaps a world language class, an art class, a music class, a physical education class, and you would have less mingling at lunchtime and recess, so as to contain the group of people together during the entire school day, so as to minimize the possibility of spreading or catching the virus.
Peter, interesting email question from a viewer who wants to know what penalties might there be for one of these independent schools that don't adhere to safety standards. If it's found that a school caused a COVID spike, could the community take any action? Is that something your schools are concerned about?
So our schools are very concerned about maintaining proper health protocols and procedures. And we know that there's always the risk that someone will catch the virus in a school environment. Our effort is to make sure that our schools are in compliance with CDC guidelines, with guidelines that are put forth by the Maryland State Department of Health, and also in compliance with guidelines that are put forward by the Maryland State Department of Education. So our plan and expectation is to comply with all of the guidance that those agencies put forth, knowing that nothing can entirely mitigate the risk of a school community member catching the virus. But our goal is...
And Peter, what happens then? I'm afraid I just have a time for a sentence on this, but everybody
Sure.
has a plan for what happens when somebody does test positive.
Right. Everyone has a plan for how to proceed when that happens. And those...
All right, Fred, we have to leave it there.
Are...
Peter Bailey is Executive Director of the Association of Independent Maryland and D.C. Schools. Sir, thank you very much. Direct Connection continues in a moment.
Can you tell us what you know?
Turning back now to the race for the White House.
The State Board of Elections voted Thursday to set up a new election.
It must be a very emotional day.
The world changed in the blink of an eye.
Children are at the heart of this story.
Joining us for our Your Health segment is Dr. Rebecca Carter, Assistant Professor at the University of Maryland School of Medicine and pediatrician at the University of Maryland Medical Center's Pediatrics at Midtown. Doctor, thank you for being with us. This is normally a busy time for pediatricians. You have back-to-school physicals. I'm wondering what the traffic in your office is like this year.
Thanks so much for having me. Yeah, so we definitely saw a big slowdown across the board in most medical settings when everyone sort of stuck close to home and was following all the instructions. But we are starting to see slowly but surely people are venturing out. We're seeing a little bit more interest in coming back to get our checkups, to follow up on all of the chronic illness. And basically what I'm here to say today is that we absolutely encourage everybody to come back and to stay on their schedule for their checkups, to stay on their vaccine schedules, most importantly, and to follow up with any chronic illnesses that they have.
Now, talk about the importance of the regular checkup, not in the setting of chronic illness, in the setting of just a kid going back to school. Maybe it's been a year since they've been to the pediatrician. What are you looking for that mandates that they come in to be seen?
So we do so much in any checkup that goes beyond coming in, whether you're due for vaccines or not. we are monitoring growth, we're monitoring development, we're monitoring social and emotional development, which right now I would say is even more important. So we really are focused on the whole of the child and making sure that each child is thriving in their home environment and their school environment. So now more than ever, we really want to get a handle on how kids are doing and to help to be part of the team to help them succeed.
I think people at the moment are scared of any indoor activities, particularly a medical office. What sort of precautions do you take there?
So we are doing everything in our power to keep the offices as safe as possible. And I would say really, I feel that we have succeeded in that. We are cleaning nonstop. Everybody is masked. Everybody who comes into the office is staying nicely, safely distanced. We are asking that both kids over 2 and their adult caregivers are wearing masks for the entire time that they're in the office. So really, this is probably the cleanest indoor space you can come to is coming to the doctor's office. We are also pre-screening everybody to make sure that we understand if there have been any symptoms. And most practices are doing either a separate entrance or some other alternative way of seeing patients who have any symptoms or exposures that could be at all concerning, just to make sure that those who are coming in for their well checks are not at any increased risk from other people.
So do I understand that everybody has a mask on all the time, except for the young patient, I guess, when it's time to, stick out your tongue and say, ah?
Yeah, we pretty much, I remove it real quick, have them stick out their tongue and put it right back on to keep the rooms completely safe and to keep everybody from any increased risks.
What can you do about waiting rooms, particularly in an urban setting where you can't really tell everybody to wait in the parking lot and we'll call your number? Is that a concern?
Yeah, so I think practices are being really mindful about the times that people are being scheduled so that we have a little bit more staggering than what you might have seen in the past. And we also, every waiting room has marked off chairs and spaces so that anyone who is in that waiting room at the same time will be kept at a safe distance. But really, we are setting a very serious goal of keeping any waiting room time to a minimum, trying to expedite getting everybody back and into their own safe exam room as fast as possible so that nobody feels at all uncomfortable by sitting in that shared space.
I guess the good news, if there is much good news in this pandemic, is that it seems to be sparing young people for the most part. Yet at the same time, they may be the age group that's most in need of some reassurance about what's happening in their world.
Absolutely. We're seeing kids just want to come in and talk. We are also offering a lot of telehealth options. So that's been a great way to engage if a family isn't quite sure they're comfortable coming in. That's another opportunity to engage with their doctor and to have that time set aside. But really, what we're also seeing is that kids are extremely resilient. There are kids who we have identified needed additional services and have figured out workarounds to have those services in place, even during all the restrictions happening right now. But a lot of kids that parents have been really worried about will come in and we'll kind of talk through, and they actually are often the ones reassuring everybody else. So kids are kind of amazing in that way, that they can get through even the most challenging of experiences, often with a smile on their face.
What's your experience with a telehealth visit? It may be that young people, more accustomed to technology, not as big a deal for them, but in terms of your ability to actually see the patient, get a sense of what's going on, what's your experience been?
So there will always be a value towards hands-on physical exam. We certainly know that we need kids to come in when they're due for their vaccines. So there will always be a value to the in-person interactions. But we are finding that there are some sort of hidden gems within the telehealth world. So we're able to see kids in their home environment where they might be a little bit more comfortable and sometimes a little bit more willing to have a conversation with their doctor, who they, sometimes don't want to open up to as much in the setting of an office. Certainly my teenage patients often are so good at their technology that to them we're able to have a really wonderful conversation. And sometimes we can even get creative. I can see in their home environment places where they could do some exercises and we can work through it together because I'm actually able to access the room that they're spending time in. So instead of kind of in theory trying to talk through exercises they could be doing right now or ways that they could engage differently with the screens and to make sure that they're staying healthy, we're able to really troubleshoot in real time in their own space.
Let's talk about vaccines a little bit, particularly the flu shot, which I don't know if it's out yet, but it'll be out soon. The importance of doing that this year, in your view.
So I think it is one of the most important things that any family can be prioritizing right now. I know that everybody is very stressed about everything going on, but one thing that I can pretty much guarantee will stress out families more is if there is a flu outbreak, if individuals in the family are to come down with new viruses, with flu-like symptoms, they're guaranteed to be told that they're on some degree of quarantine, whether or not they can get COVID testing. So if we can prevent that flu season from taking off before it even gets started, we are setting ourselves up for a much more successful fall. So even beyond the fact that I recommend it to all kids every year, and I do strongly believe that it has that benefit, this year more than ever, I think families will value it for the health benefits and absolutely for the convenience benefits of keeping flu at a minimum.
How do you think people are going to react when the coronavirus shot itself comes out? I've seen some polling that people are maybe not anxious to be in the first row for this, which probably is going to go to people in a healthcare setting, people who are really at risk anyway. But there's a little bit of suspicion about it because of the urgency of getting it approved.
I absolutely understand where people are coming from, but I will say that I think that we have some of the brightest and most dedicated minds working on the creation of these vaccines. I know that some of the vaccine studies, while they're going fast, a lot of what's really being expedited is the ability to produce enough vaccines in the volume that they need, more so than any expediting of the safety. So all of these vaccine trials are going to go on for several years, just as they always would. We're just kind of getting to skip some of the other stages of ramping up and fundraising because everybody's really committed and dedicated to trying to find a solution. So I definitely understand families' concerns, but when you look at how a typical vaccine is produced, there's not necessarily all the steps being skipped that people are worried might be getting skipped. So I do think that it's going to be something that is going to be demonstrated to be safe far in advance before it's made available. Certainly to children, it's going to be demonstrated to be safe in many other populations first.
Lastly, I wanted to see if you wanted to volunteer any thoughts on something we were talking about earlier in the program, which is schools either reopening, partly reopening, doing distance learning with all the kids that you talk to all the time. Your perspective on what the priorities ought to be there.
So this is going to continue to be hard and honestly will probably be a moving target for a while to come. The American Academy of Pediatrics has recommended to aim for getting kids back into the school setting, but they very much have given the caveat that that should be done in the safest way possible when certain criteria are met. So it really is a region by region decision, and then locally a family by family decision from there. So there are some studies that do show that while kids don't spread it quite as much as adults, we don't quite have the same understanding about how kids can spread this because for the most part, they haven't really been around each other. And some studies show that it's decreased, some studies show that it's increased. So it's a challenging idea to wrap our heads around. We know that if it's done in a safe way, we can encourage, if all those other parameters are met, for some safe ways for kids to start getting some of the learning benefits and emotional and social benefits from being around peers. But we also know that if the anxiety is there to such an extent that they're not able to concentrate on school, that might not actually be the best decision. So I think it's really going to come down case by case, person by person, family by family, to what is right for each individual child when there are the options. And I know a lot of our local school districts right now, it's not really a decision to be made because most of them have gone remote. But even for the families that have that option, it's really case by case.
Dr. Rebecca Carter, University of Maryland, Midtown Medical. Dr. Carter, we appreciate the visit. Thank you very much.
Thanks so much.
And coming up this Friday on State Circle, the latest on the debate over how to hold Maryland's next general election. Should it be in person? Should it be by mail? We'll get the latest on that debate Friday at 7. Remember, you can see videos of all of our local MPT programs at video.mpt.tv. That's video.mpt.tv. And follow us on Twitter and Facebook at MPT News. Now, for all of us at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.